My name is Janine Joswick, and I'm the owner of Nature's Balance Acupuncture here in Crystal Lake. And I am so honored to be here with Dr. Rick Segal. He is an amazing integrative practitioner, and I am really excited about announcing our collaboration together here at Nature's Balance. We are going to be working together with patients for the best of patients this entire time very easily and very smoothly. So Dr. Rick was practicing integrated medicine way before integrated medicine even were a thing. And certainly before the time when Western medicine practitioners would leave Western medicine, go back to school, learn how to be a functional doctor, identify the root cause of the problem, treat that root cause versus just prescribing meds and slapping it on and covering those symptoms. So Dr. Rick has been doing this since high school. He's got lots and lots of experience, and that brings together a very unique opportunity here in Crystal Lake, especially in McHenry County. Most functional doctors here in McHenry County, they treat under their roof, they do functional medicine, and that's all they do, and they may or may not refer out to another practitioner if there's a gap in the care. Whereas here we have under one roof, a truly integrated practice, much like they do in China, where in the hospitals they have Western physicians, and they have herbalists, and they have acupuncturists. So as I said, Dr. Rick has been doing this for 30 years. He started in high school, believe it or not, combining modalities together. So he was an entrepreneur before his time. And he's been doing things for improving athletic performance, increasing longevity, improving and increasing healing times. Tell me your origin story. Where did you begin, and how did you get here?
That's okay. Do we have
a few days?
3 hours? But thank you for the nice introduction, Janine. And I am very happy to be here in Crystal Lake and see how we can effectively move the community to something healthier. I mean, I think you're doing a great job. You're doing a great job now, just with regards to the patients I send over, and a lot of them will actually not only take off from the suffering just from meeting you, but they'll usually launch into some other initiation of lifestyle. So that's what I've always found, is that lifestyle really has to be the way we pivot and change the way disease affects us. And you had mentioned that going back to high school. My first experience was Professor Hank Shin, who taught Hapkido to me at the Police Athletic League, if they have that anymore. A friend of mine, we were supposed to take our first belt test, and a friend of mine was doing an elbow strike where you turn 45 degrees and you come down to break elbow, but it was a fake movement. He just happened to be next to Professor Shin's table that he was using outstretched at seated level, and he broke the table. So that's another story. However, he was rubbing his elbow, and by the time we were finished our belt tests, Mr. Shin took him upstairs. And he said, "Sit there at the kitchen table." He took out this small box from a cupboard somewhere, and it was full of powder and these little tiny incense. I remember him holding about a 3mm by 5mm incense shard, and he put it right over here. Now, as you know, that refers to, at least now I understand, it refers to one of the meridians. Now, Hank Shin was Korean, but there are different forms of acupuncture and meridians in different Asian countries. He put something there on, I forgot his name, on his elbow, and he didn't ask the parent. I just thought about that, but back in the 70s, I don't think we needed parental consent. And the guy, after the incense burned down, it was about 15 minutes, and Mr. Shin just did some stuff to his hands, or to his arms and shoulder, and he had no restrictions. That was my first experience to say, hey, this is kind of cool. So I started, and I was an athlete back then in martial arts, and in martial arts, as you know, there's always a spiritual basis to martial arts. There's always a nutritional basis to standard sports, organized sports of high school. And that made me pay attention because I loved what I saw. I enjoyed exercise. I loved running. I was more independent. But from that point forward into, 20, 30 years later, I might be dating myself, but 30 years later, going into medical acupuncture and having the same ideas and successes and excitement conjure up when I was sitting at UCLA, watching one of the guys that I think I told you in a previous video, I was going to book, just sign my name and go to Santa Monica Beach. But I was challenging him, sorry, Dr. Helms, but I was challenging him every way I could to see if this preposterous stuff really worked, because I had an MD. So, and obviously it worked, and here I am. I don't practice acupuncture reluctantly. I don't practice acupuncture as much now, but that's why I seek out really well-trained acupuncturists and other people in the complementary field. I think that alternative medicine is sometimes poo-pooed in Western medicine and conventional medicine, if you want to call Western medicine the same. But I have seen, living in that footprint, I have seen successes, and I cannot deny that. But now there are some studies that are backing up the successes. So as you know, with Western medicine, we base a lot of things on data. And sometimes we're too data-driven to say, can't do that unless it's been proven. But a lot of the things that we use and you use to implement and change lives really works. So do we have to have $1 million randomized controlled trial? I don't think so, as long as it is not dangerous. And that's where I love being in integrative medicine. So long answer to a short question. I started back in high school, I just paid attention. And I experienced the healing later on down the line. With regards to traditional Chinese medicine, with regards to yoga. I also became a certified yoga instructor with the Chopra Center because I found that it helped. And being a sprinter, bodybuilder, you know, all those sports, including powerlifting, I'm not supposed to do yoga as a guy. That's the thinking, sorry, but that was the thinking before. But then it turns out it saved me. So it put me down this alternative. I was already there, but it kind of reinforced when I moved away from alternative and complementary medicine. It reinforced the fact that I have to reel this back in because there's great value in that as far as lifestyle change.
Amazing, amazing, amazing background. It's you have such a vast, and we've only touched on like about this much of his history. You need to go and read his bio to really get the full impact of everything he's done. For the people who don't understand what integrative medicine is, how would you describe integrative medicine?
Well, okay. So most people would probably see if I put an image of Andrew Weil on the screen, most people would have at least seen him on Dr. Oz or Oprah. And he's not publishing as much anymore, but he was the trigger that got me to think about it again. When I was running a sports medicine clinic with Central DuPage Hospital, 1995 to 97, there was this, in my office in Wheaton when I worked for Central DuPage Hospital, there was a new grocery store that was opening up. I was very comfortable with being sports medicine and telling some folks at that point in time, I can help you with your medical problem by fixing it musculoskeletally. And there's definitely a link between suffering and ailments and movement. But then I'd go to that new grocery store and I found this guy's face all the time. And the grocery store was Whole Foods. I didn't know, I've never, well, back in the 90s, I didn't really hear about it, except for it being kind of expensive, and they had an organic section, very big, vast organic sections. So I would go there on my lunch break, because it was right across the street, and I would pick up magazines. I'd see Andy Weil's face all the time, and I thought, you know, I remember him from before. I gotta see about, so anyway, I chased that, what I thought was a pipe dream down, because you could train with the man who started integrative medicine as a popular specialty, but you have to go to Arizona to live there. And I just couldn't, and I was running the sports medicine clinic. So I put it away, but eventually it came back to me again. You know how the universe always tells you, you're on the right track, or nope, get off this track now. And if you don't listen, then the signals get even louder. So later on, about 7 years later, I got an invite somehow to join the fellowship. It's a fellowship, it's a 2-year fellowship, and you learn about complementary alternative medicines, you learn about considering the whole person has your focus, not just a cholesterol level, a weight scale, a blood pressure reading, which unfortunately I think is one of the setbacks with Western medicine. With conventional medicine, it's getting so streamlined and insurance-based that you have to have a diagnosis to get into your doctor's office. you can go in with wellness once a year, but the wellness visits that I have been witness to, including my own family, very cursory, very quick, and then it includes a smattering of different blood tests. So if the identifying factor of if you're in danger or not, and should I deploy a lifestyle change with you, if the identifying factor is only going to be a blood pressure, a cholesterol level, or say a weight on your scale, then usually the implementation of change won't happen until they're high and out of range. And at that point in time, as you know, when we hit 40 to 50, it is really, you're dug down deep with habit, and it's really hard to reverse at that point. So the only rescue would usually be a prescription, which is fast. However, if you don't change the root cause like you're doing, you'll be on another prescription because you haven't changed the direction, in my opinion. And that's where I think integrative medicine is beautiful, because we take the whole person, and that's spirit, mind, and body, and we take options, lifestyle options too. So if I have somebody that says he eats okay on his own, that's his words. I use guys because guys are notorious for this. I use guys. And then I say, let me see some of your pictures. And the pictures are not, they could be better. They could be fluffed up a little bit. And then I say, okay, I don't do it in a demeaning way, but I say, listen, what did you find from your 5-day upload of all your foods? And usually they'll notice that, oh, I'm taking too many energy drinks, or I didn't realize I'm snacking too much. And that's the first reveal to hang a hat on as far as motivation. So I try to take them from that point and then show them how we can improve. And my registered dietitians can probably do that too, but it takes a lot of time. And Western medicine just doesn't afford that. So that's the beauty of what I offer with the integrative model approach, is to figure out who this person is in the room, figure out what the successes were, figure out what the challenges were before, and moving forward, is there any risk? Once we've established that, then I'll look into lifestyles that they have attempted, lifestyles that they have options for in the community, what they can afford, and nutrition changes that might be helpful, or physical changes if they are already suffering from bad knees, bone on bone. I honor my orthopedic surgeons, for example, that say, bone on bone, you're eventually going to need me, but we'll postpone for now. And I honor that, but I think there's many things that you can do even if there's an x-ray that says bone on bone. Again, I don't try to treat the person who has an x-ray or a cholesterol level. I try to treat the person with what they have and get them successful. Even if it means that I have to call in other people, their relatives, other old coaches, a nutritionist from far away that does video for vegans, because with all the different food types, there's carnivore, paleo, keto, intermittent fasting, prolon boxing, FMDs, there's vegans, there's different levels of vegan. Everybody has a level where they're at, and I think that we have to acknowledge that without poo-pooing it, and then build upon it to find a different direction. So I always think of it as a timeline. And if I'm going to jump to one of our spoilers, but my usual saying is that the answer to the cure is in the words of the patient. But you just have to ask the right questions. I really inherently think that we all have the energy that tells us what we're supposed to do. And if we're not doing it, then signals come down that, hey, come on, you trip, or whether you believe in energy medicine or not. And some people, it's a tough concept, but that's what meridians are. That's what Chinese medicine, that's what the chakras of yoga are. And that's also, you see somebody walk into a room that's just beaming. There's something about that person that I want to be like that person or be close to that person. There's something, and that's usually because of health. I mean, you can see that as movie stars walk through, but there's always going to be, it's not really that attractive. And then there's somebody that's not that intensely good looking, or not with the most expensive clothes, but they just have this way of the way they carry, and that's, to me, is health. And that's why I think that if we can figure out what's happening with the one person, I think that we can expound upon that. It's almost the shortcut to figuring out root cause. If you know the person, then you can kind of figure out, okay, I think I know where our challenges will be, and focus on that and build up from there. But that's kind of the difference between conventional, which I think is good. In the United States, if I have a trauma or a cancer, hopefully never, but if I do, I want to be here. But if I want to live a healthy lifestyle and make it to 100, here maybe in Loma Linda, California, but otherwise we have to look at how other cultures lived and think outside the box. And unfortunately, thinking outside the box means moving away from conventional medicine. Conventional medicine is good as a rescue, but I think lifestyle change comes outside of that.
Are there any times where you actually do recommend meds? It sounds like the very first, if your first choice is lifestyle, maybe food choices, supplements, herbs, those types of things, but do you ever recommend actually prescription meds?
I do. So a lot of my patients, what I love to take care of is chronic and complicated cases. Okay. To me, it's a broader timeline, and the answer is in the timeline. It just might be that this map is really confusing. But if I spend enough time, I really think you can find a way out of the woods. So some of my patients come in with disease exquisitely presenting and suffering. So I would not say just stop your statins, stop your pain medicines. No, I think there's ways to do it in an intelligent way. But usually I will give them the carrot, I guess, in front of the horse. If you stick to this, because motivation has always been fleeting in today's society. If you look at what do you call the reel? If you look at a reel, you just scroll up and you can be stuck, although these things are 30 seconds if you, hopefully you don't watch too much of the reels. But on social media, you can get these things called reels where you just, interesting, stupid, next, interesting, stupid, next. And then before you know it, it's like, I just wasted half an hour doing nothing. That did not improve me. So I think everybody is used to fast action, fast answers, fast relief. And maybe that's the fault of the doctors, but it's definitely a fault of buying stuff and idolizing iPhones and what have you. But sometimes lifestyle change will take more than 3 months. I just talked to a guy that was told that exact same thing. He has some wear and tear. He tore his ACL, had it fixed by an orthopedic surgeon, and it was a cadaver ACL. It's a ligament in the kneecap. It's the one that the professional football players always tear on the field with AstroTurf. And it can be easily fixed. And I was with, when I did my sports medicine fellowship, the ortho that I trained with prided himself on being able to get Tommy, I probably can't remember to mention his last name, but Tommy to go back in 4 months and slam dunk again on an ACL that just got repaired. And if you watch the video, it's like, oh, no. Because you're not supposed to do that. It's supposed to take time. But I think we are all wanting fast, really immediate relief and or satisfaction. So I think that motivated folks, incentivized folks will be more engaged in maintaining instead of me seeing them once a month. I can certainly see them once a month. In fact, I offer that with one of my packages because some people need that, but should be able to find a root cause, address the root cause, come up with a directional markers and changes, and then send somebody out on their own. If they can't, then they need people, other coaches. And so bottom line is that sometimes the diseases that they come in with and the suffering really requires me to continue medications. However, I will put my flair on medicines. If we can put anything into a topical, I would rather use topical. If we can put anything into an herb instead of a prescription, I'd rather use a supplement. I think that if you look at the average insulin resistance, the average body pain and trigger points, the average difficulty with going to sleep, the average anxious patient post-COVID, the first thing that always comes to my mind is magnesium. I think magnesium is a fantastic supplement that we are really peeing off because of the blood pressure medicines that we give. I do give those. So if I have somebody along the same lines that has an urgency to control hypertension, or worst case scenario, hypertensive emergency, 180 over 100 with symptoms, no, we have to calm them down first. And so I am well versed with what to do with the standard protocols, whether it's cholesterol protocols, hypertensive protocols, when to get colonoscopy protocols. I have to follow that because that's part of the standard in medicine and being board certified in Illinois or any state. But by the same token, I have been around the block enough. I use compounding pharmacists. I have a couple of different brands that I am comfortable with. I always go to consumer labs and try to see who is evaluated. And I only use, if it's not evaluated on consumer labs, then I'll only use popular companies that I'm comfortable with to supplement for things that they could supplement. I have a gentleman that was placed on a low dose of cholesterol medicine. And I tried to look, he's 47, we're working on his BMI, but I asked, what are the risk factors? And he didn't have any risk factors. He exercised occasionally, he's a little bit overweight, but there's no genetic markers in his family. So I was wondering, why did the doc give him statins at low dose? Because nowadays the protocols are there and they're aggressive with lowering cholesterols to almost zero. And I think there are some cardiologists that wanted to put statins in the water sources. Because the theory is that with some of the studies, they do say that statins seem to have this anti-inflammatory property that is helpful for somebody with heart disease. But walking in nature, having a whole food, mostly plant-based diet, getting really restorative sleep, taking care of pain and just moving, that has a great anti-inflammatory effect too. And every protocol in the United States that's given to doctors, made by doctors, always starts with the phrase, after maximizing on lifestyle change. After maximizing on healthy lifestyle change, then deploy the protocol. But I think that
you jump past that?
Yeah. Well, it's the easy answer. I'm not saying everybody does this, because I know some gut doctors that spend time and they don't go straight to it. They give them some chances. But unfortunately, the majority of visits are usually I think they're 15 minutes with an average doctor. And since the specialists are I hear they're getting less reimbursement, they're also speeding up. I sent my daughter to somebody in Urbana, cardiologist, because she was having palpitations. He walked in, the cardiologist walked in, said, I think you'll be fine, and walked out. Didn't even let my daughter say anything. And it happened again here when my grandson was taken to urgent care. And I work there too, and I understand the speed that you have to engage, but it's not right.
Yeah, it didn't feel right.
I think the state of affairs is what it is. However, I like to empower my patients, my community, my friends, to see past that instead of thinking that what your insurance is the way you get healthy. I think we have to take the onus on ourselves.
Exactly.
And I think there's a generational change. If we change the way we behave, like you ski, and I'm sure if one of your grandkids sees you and sees pictures of Aunt Janine skiing down whatever you ski down, that would inspire somebody to say, wait a minute, wasn't she in her 40s when she did that? And that would just, when they're ready, then they'll say and remember that. I'm hoping that happens with me too, that when my great-great-grandkids see pictures of me climbing mountains or meditating in my 70s and 80s, that they'll also buy into that when they get challenged. I hope I can convince them before they get challenged, but I can't convince everybody.
Right.
But when the time comes and you have to pivot and you have no other options, then the only thing you have is total knees, chemotherapy, cut off a limb, and or big medicines. And I think there's other things that we can deploy.
So you touched on a few types of people you see. So are there any common, like, do you have any specialties? Do you treat pretty much any type of condition or disease?
I have, it's ranged. I like to pride myself on, I'm very comfortable if somebody comes in with pancreatic cancer and stage 4, I'm comfortable with helping their current team, to optimize how they feel. That's a terrible disease process, and usually the outcome is very slim, but that's still a human being in front of me. So if I can squeeze out a couple of months, that'd be great. Or just make the last couple of months doable. Then I'm not afraid of that. I'm not afraid of autoimmune disease. That's also a complicated disease. And usually my folks, I have a handful of guys, gals that come to see me that are on DMARDs already. Really, those commercials you see on TV for the rheumatologic or psoriatic arthritis patients, they're on a bunch of those, or they're switching every couple months. And they're suffering, but I'm not afraid of that. I can work with a rheumatologist, although I'm very open to sending my notes and my opinions, sharing my opinions with my specialists and colleagues, but I haven't really gotten any feedback. Even if I send a letter out, this is what I would do. politely telling him I did a free consult or something like that. I've only been responded to once in a couple years, and that was from the oncologist that I was dealing with a patient. Other than that, maybe the docs don't have time, but as we talked about earlier, I think doctors don't even talk to each other. There's no time. I can sometimes get a fly-by telephone call really quick from a specialist, but it's usually less than 30 seconds directly to answer one specific question. And then, of course, I disconnected with any hospitals. I did not find there was a need. Nowadays, primary care docs don't even go to the hospital. They have hospitalists that would cover any patients that get admitted. So I did not go to the hospital before when I was working in Bartlett, and I definitely did not find a reason for me to be in a hospital. I don't see it's worth paying the privilege amount. Lyme disease, comfortable, but Lyme is a funny one because by the time patients come in with complicated diagnosis, they have probably layered up several different problems on top of the Lyme. And I think that the thinking is tough because in that patient population, it's almost like every disease process, every symptom can be blamed on Lyme. And I do think that Lyme is a scourge. However, I think there are other things that should be identified as other roots to address in addition to chugging away at the Lyme. And so I will have to have an oncologist involved. I would not divorce the oncologist. I would not ask the patient to get rid of their specialist, their rheumatologist, their infectious disease guy, but I would work as a supplement to their care. Fibromyalgia is my pride and joy because I suffered from that for the longest time, from the 90s up until I don't remember when. I declared it a remission, but I was doing it before it was a diagnosis by the American Rheumatologic Association. Okay. But they came up with a diagnosis that included 3 bullet points, and I think, oh, that was great. But I was doing that before, and the treatment didn't change. And in fact, there's no treatment. There's a diagnosis, so you can put it on the books that you saw this patient, but there's still no treatment. No, there's a medicine called gabapentin. There's maybe physical therapy. So there are treatments, but nothing that involves deep down lifestyle change like that we would implement, or so I'm very comfortable with that. So the only thing I probably don't see anymore, I don't see pediatrics anymore, just because I found that since I have to step outside insurance-based visits, there is an investment, and I do feel that I reward my patient with every penny back. And that takes time, but I found that when it comes to kids, they're not as motivated to invest in the change as the adults are. So, early disease, I do have my go-to pediatricians that aren't too keen on just throwing antibiotics at every sniffle. So I have a handful, but I've decided not to go down the route of less than 17.
Okay.
But I do think that if the 17-year-old is suffering, the likelihood is in the same household that the adult is suffering. So if I fix the adult, and I want to help the primary adult, and it's usually going to be the mom. Sometimes sometimes they're dads, but I usually will say, okay, I can't do this, but let me ask you about you. And if I can get them to change, it might make them rub off on the younger person. It definitely will make them change the food that they're given to the younger person,
right,
and the sleep habits, and the time that you're allowed. So if I can implement change with the adult, then usually the secondary effect will be the child.
Nice.
If I can't take care of children, then I will do as best as I can to suggest who I would go to. Behavioral therapist, pediatric physical therapist, acupuncturist. Sometimes my younger people are afraid of needles, so I just tell them we can go to cupping. We can go to, in yoga, we have marma therapy. That's kind of like meridia therapy. But we don't always have to, we can go ear points. So there's always an option. But again, it depends on the dynamics of the family.
So based upon what you said, most people would maintain their general practitioner as their primary, and they may go there for blood work or whatever, and then you're kind of an adjunct or potentially taking over more of the care for a particular, a big condition, as I would put it.
Right. I have to refrain from saying taking over because I think that some of my colleagues will be apprehensive to refer.
Yeah.
I think they're apprehensive to refer anyway, but it doesn't matter. However, no, I have no animosity towards Western medicine. It's not butting heads with my specialist. As far as primary care guys, I think I have the training and the experience over the last 26 plus years to give them colleagues advice, especially my 2 cents. I am a specialist, and hopefully, if it works out well, I'll be double boarded by fall of 2023.
Oh, right.
I hope so. I'm going to start attacking, and then 2024, my goal is to actually be an exercise physiologist and start my BA again. Anyway, so as you know, we always have to continue education. Right. And I think that's where my colleagues might fall short, because the only thing that inspires us to continue with the education process is continuing medical education that we're supposed to do every 3 years, 150 hours, I believe. And it's up to the physician as far as which, I mean, you could take what I did, take a weird course called acupuncture and just sign your name off and pay for $600 and go to the beach. But that's the incentive to continue education. But I really think that science is changing so rapidly that we have to make it a point as physicians or acupuncturists or coaches, make it a point to always scrutinize the information that our patients are reading. Because I have a lot of patients that are well read. There's a lot of information on TikTok now on Ozempic, has a shortcut for just losing weight, right? And I don't agree with that because it's taking it away from my patients that have diabetes. And that's another thing. If I have somebody with diabetes, I know that they want to get off insulin and off this and off that. But there has to be a slow transition because the body is used to that. And the timing of the day is used to prescription medicine. So if we just go 180 and stop medicines, do nothing but herbs, that can be a rocky start.
Right. It should be a weaning process.
Yes, exactly.
A weaning process.
So I don't want to. So it is. It does help that patients maintain their team, unless they're very unhappy with their team. Then that friction is impeding success. So then I'd have to look through the hospital that they're associated with or their insurance plan, and I've done this before too, and kind of test the grounds and see. I just made a phone call. A patient of mine, he's 70 plus, and is going through a lot of suffering with his wife, but he too, this guy was right on. I mean, he exercised, he does yoga, he watches, he's the reason for me to start reading back in the 90s. I used to get, I won't mention his last name, John used to come in with his ream of paper and all the studies from NIH, and I'd have to, oh no. I have to read this stuff, but in actuality, I did read it. I couldn't just say I read it and it doesn't make sense. I had to read it, and he had some really good information. But that triggered me to continue reading, and that's when I went over to this grocery store called Whole Foods, and I started reading their stuff. And so I think I learned from my patients that if they're dynamically changing, if the community is getting smarter, I have to stay on my toes to help them with the choosing or sifting through. So there's some information that's just downright wrong. And there's some information that really can apply, and it's very confusing. What do we follow?
Right.
And everybody, it's not cookie cutter, so everybody has a different level of entry, so I have to be the one who sifts through that. So by default, we have to continue reading, and it takes away from our lives, but I think we make better healers. So I would never get rid of primary care. If there's an emergency, you still have to get back to the doc.
Exactly.
I think hopefully this COVID thing will be done before the next election, and then we don't have to worry about at least COVID anymore. But I'm sure there's other things, other catastrophic pandemics that are coming down the line. And if we're not ready for them, whether it's that or age that brings us into high risk for cardiovascular disease or cancer or stroke or heart attack, we have to be prepared. And again, going back to what we started with, I think that making our communities healthier, making ourselves healthier, our colleagues, will start this explosive wave of health. Because the communities that I'm in everybody's suffering, and there's so much anxiety and mistrust. There's a lot that has to be changed, and I think that this could be the great start, especially us working together.
Yeah.
If we can start with us and then move out to our communities and move out to our counties, maybe have an internet presence to get other docs to do the same thing, that would be awesome.
Yep. Very much like in China. My vision is always, even before I had a practice, I envisioned an integrative practice, and this is what I envisioned. So it's coming to fruition.
I love it. And I've always had the same picture, but it's just been very frustrating and a bit lonely to say, and I guess I was a little burned out and saying, I can't do this anymore. So I kind of lost that picture, so I'm glad you still kept it up, because you've reinvigorated my devotion to say, I'm going to be in this game for a long time because people need us.
Best set the example. What's your first appointment like? What can they expect? Should they bring with them? Should they plan on bringing tests, or if they have tests that are a year old, do you still want to see them? Tell us about that.
I have patients now that come to see me from a distance, outside the state, outside the U.S., or within the county. My old patients, or people that have just come across my website. I've been lucky enough for having a couple of patients come out of Chicago just because they saw that I did my YouTube Herbal 411 website out here. So thank you guys. So this social media thing that I started in 2007 is really, I did it for, honestly, I started videos because I didn't have enough time in the algorithm of Western medicine, and instead of repeating myself as far as take red yeast rice or this is the brand I like, I started doing videos to shortcut my time spent in the office to honor the guys that were paying my paycheck, and then I gave patients homework sheets. And the homework sheets would usually have a link to a weird video I did on YouTube, and it would be okay. I mean, the quality of my early videos are terrible. I look at it thinking, oh my gosh, did I do that? But I don't care. As long as patients can stay engaged enough and they get the after visit enthusiasm to continue the motivated process of change.
Right.
And so I started with that, and I've built it up to where it is now. And my presence, or at least I should say the presence that I have online, in addition to how patients reach me, is always going to be through herbal411.com. I've used that as my destination point since I left Western medicine in 2020. And it's worked out well. It's not the most expensive electronic medical record, but it's decent enough so that I don't have to charge patients more. So my data is there. I'm always evolving it depending on who I'm working with as far as online presence, but who I am is there. Patients' reviews are there. The template on how to get in to see me as a first-time patient is also there. So typically I've divided it into two options. The first option is somebody that's tentative. They're unsure, but they're definitely suffering, and where they're at now is not working, so they're looking out for somebody. If they're unsure, then I offer a single consult. Single consults are spent, I will usually honor the patient and say, okay, before we use up your single consult, which can last an hour to an hour and a half, an hour and a half to 2 hours in some cases, and I usually end up going over, but that's on me, that's okay. But again, if I can get the answer out of the words of the patient, then better. It just takes time. But I will always front load that by saying, listen, why don't you give me on the electronic medical record, you're allowed to do this, upload your recent data. I'll review it. And then if I find that your doctor didn't do enough, or they're unaware of some of the nuanced blood tests that are higher predictive, like cardio IQs. I love cardio IQs because I think they give more value than the standard calculated 4 cholesterols. If there's no risk, I can go with the 4 cholesterols and then move forward and see if we can change those 4 cholesterols. It's a calculated number, but it's an outdated calculation. And I think if the patient does not have to pay for too much, I will say, let's get a cardio IQ. Cardio IQs are typically done with Quest. They not only do the 4 standards, they also do break down particle count. So LDL particle counts, HDL particle counts.
So size.
Definitely,
size.
definitely. And I think that's very definitive to say this is a risk, this is not a risk. LP little a, the value out of the Cleveland Clinic of LP little a is fantastic compared to the 4 standard calculated values. But I think that because insurance companies are still considering it experimental, that doctors are hesitant on ordering it. Because somebody will come back and say, hey, why'd you make me pay for that expensive test when last year you got me the 4? So I will suggest loading as much as they can, I will ask if we can do more. If I find that they have to do more, I need some more supplements to figure out just with the data if we are high risk or not, I would order more tests.
And do they run that through their insurance company?
Yes.
Okay.
Typically, but as you know, most people will have catastrophic insurance only. It'll pay for an annual wellness, which I think is, again, 15 minutes for annual wellness, forget it. The wellness exam has really come down to just checking a cholesterol, a basic metabolic test, maybe a thyroid and a vitamin D, and that's it.
So really a dumbed down version.
Very, very truncated, very truncated. And I'm not sure because there's not much, if you have massive disease, you'll have an abnormality with the truncated stuff. Mm-hmm. But
by then the train's left the station.
Yeah, exactly. You've already stepped into a world of crap, and it's going to be hard to get that crap off. So I'll do insulin levels. I'll get them a continuous glucose monitor. If they can't afford the blood test, we'll at least try to get a continuous glucose monitor and see what their glucoses are, depending on stress, eating snacks, not eating, fasting. And that's something. I'll ask them if they can't afford the blood test. I'll ask them if they have a wearable device. I'll get a sleep pattern, even though they're not exact compared to in studio or in hospital sleep assessments. It's a marker. So if we can get the more data we have before that one single visit, then the more I can give them on a map of how to get from point A to summit, is what I like to call it. Summit of conquering disease or getting symptom free or out of danger. So if they don't have a wearable device, if they can't afford blood testing, I can go old school too. But that vision board that I put together it might go over the 2-hour mark. But I can still, one way or another, I get as much as possible for that single consult. I put as much information in a narrative form and a plan of action, or hopefully it's actionable. Mm-hmm. And then I tell them, listen, I really have to see you in 6 months, so you got to come back and see me. Or you're good, you're boring, I'll see you in a year. Unfortunately, it's not that often. I have 3 patients that are boring. And most of the others, I suggest you probably should see me again sooner than a year's time. But I understand some people economically are challenged and they can't afford, but at least I try to, in the narrative, say, you can always follow up with your doctor for this. If you feel this, although your TSH, thyroid stimulating hormone test, TSH is normal. If you're still losing your hair, your eyebrows are falling off, and you're constipated, please consider asking your doctor gently for increasing your dose. So I'll give them a plan of attack. So that's usually the single consult. If I feel that somebody's really got to have me for more than a single consult, I would highly suggest they sign up for the annual membership.
Okay.
The annual membership is less than a single consult, but it's made so that it's, in the end, cheaper than seeing me several times piecemeal throughout the year.
So how many times can they come in to see you?
If they haven't, I have one of my patients is constantly, it's not, I don't mean to say it in a derogatory way, but I like it. So they're constantly texting me, and which should be available to any doctor, even insurance-based or not insurance-based, but I'm seeing that person once a month.
Okay.
So once a month, I think it's fair once a month. Anything closer than once a month, unless you have COVID. If you have COVID, I have to see, I'm not going to see you in the office, most likely, but I have to hear how things are going day by day.
Yeah.
Until we get out of the COVID symptoms. If it's chronic COVID, definitely more than less frequent than day by day, but it's all dependent on the patient suffering.
Okay.
But with the annual membership, it's just meant to give higher success rates to folks that might have to get in to see me more than just once.
I assume based upon what you said, you can do people who are remote. And they don't have to come into the clinic. Obviously, the people who come to the clinic, they have the advantage of everything that we offer here, along with the integrative side of it. But if they don't, you can do it via telemedicine, right?
Definitely. Yeah, I had, in the last 2 months, I had a consult from Australia, I just had a consult from the Netherlands. And, socialized medicine isn't that great. I know everybody talks about it. They're both socialized medicine.
Yeah.
One is Commonwealth, the other, I'm not sure what Netherlands is, but it's paid for by the government. It's still tough. When I tell them what I would do as far as blood tests, they go back to their doctors, and it's still hard as nails to get the doctors to get stuff. So I sometimes have to default to those to just do the food changes, the incremental
lifestyle changes.
Yeah, lifestyle changes only. But my gal in the Netherlands, she can get on iHerb, which is access to U.S.-based supplements, I think,
Yeah.
and you can send them outside the U.S. So there's always ways, but I can do virtuals, I can do in-persons. In-persons are better because I can take a fat percentage measure with impedance, and there's something that visually I can see the nuances of. If something goes like this, then I'm not going to suggest that suggestion anymore, because that's probably not resonating with the patient.
Right.
And or I can at least see why you're reacting that way. Let's talk about it. I'm not a psychologist. I have a great psychologist that I work with, but I want to be in the same tune as the patient. It doesn't help to do this. It's too much of a fight. We should be doing this, walking side by side. Like my religion, you always walk side by side with your healer. In doing this video to show our communities what we're going to offer, I have to tell you, it got me very excited. When hanging out with the person in the room that's the hardest working, or spiritually, there's something special about this person. You know it attracts you. Your ears perk up, your senses focus, and something says dopamine or adrenaline, go that way.
Yeah.
So it gave me energy to investigate. But when you asked me to come over and share some time, I was like, hey, this is going to be cool. And then I started getting excited about medicine again. I mean, I'm always, since I left, believe it or not,
Yeah.
At first it was heartbreaking, but then I saw that the universe was telling me, if you are grounded well, you can find your direction. But I think a lot of us are not grounded well, and I think a lot of us can't see the direction with all the conflict or camouflage. And sometimes it takes an overwhelming amount of enthusiasm to see where I'm supposed to go. But this definitely gives me the energy bump to say, I have to do this. I know what we're doing is right. I know it's necessary. And I think that working with another healer that is attuned to the same thing will be exponentially better for me, you, and this community that we're serving. So it's invigorating me, and I just turned 60, so I thought, okay, testosterone's going to go down.
No.
Yeah, right. I know.
No, we're going up.
Yeah, we're going up because projects are cool. Having education and reading on science as it evolves is cool, but this is laser focusing on providing something that's different, and I don't want to say better, I'm not that way, but different and more successful with less effort. I'm looking forward to presenting what we have available to this community and farther. If we can be the nidus for the first integrative immediate care center, I've always had that in my mind because they have it in other countries.
Yeah.
And it
Oh,
works.
absolutely,
Right.
absolutely. Well, during COVID, people were coming here. You know, people would call around, and all the other acupuncturists were closed, and I got a lot of patients as a result of me just being open. And they would come and they say, "Oh, I don't want to go to the doctor. You know, I have this back pain. I don't want to go to the doctor." And they would come and they're still patients today. So
That's great.
So it was kind of, I was the alternative that people turned to. I personally am so excited. I can't even begin to tell you because, I mean, like I said, it's been 16 plus years. When we were in school, we had to do a paper on what we envisioned, and that was what I envisioned, and finally coming to fruition. So anyways, I am very excited. I'm glad. I'm so happy I waited as long as I did to have you here.
And I am very glad as well that you maintained that vision, and I am very grateful. Janine, thank you.
Wonderful. We also going to have seasonal specials going along with Chinese medicine. Every season there's a different focus. Well, every season there'll be something new. So you want to check out the website. You'll be able to schedule via my website, and we'll be getting more information out as we go along. So again, thank you for listening to this entire video, and I hope you all have a happy and healthy day.
Thank you, Janine. Thanks, everybody.
Thanks.
Stay healthy.
Bye.